Dr. Dale Geyer of the Geyer Institute of Molecular Medicine is with us now, and you have been called the guru of anti-aging medicine.
Well, thank you.
And we're so glad to have Dr. Geyer with us. We're talking about stem cell therapy and how it can help you live a longer, healthier life. How does this all come in with the anti-aging medicine?
Well, to me, it's a natural springboard to the whole idea of anti-aging and improving one's lifestyle and health in general. But I really do think, in my humble opinion, stem cells will totally change the face of medicine because there's so many things it's beneficial for. But these days, it's really come technologically to the point we can actually do it in the office just by aspirating a small amount of fat from the patient. And from that fat, you can isolate their own stem cells. And then you can reinfuse it back into the body, either as an injection to heal a joint, for example, like a hip or a shoulder, or as an IV to improve heart function, liver function, brain function, or repair old injuries. And to that end, it's truly fascinating.
So it's able to help with several ailments. And fibromyalgia, we were talking about that a little bit earlier. I didn't realize that it could help, with relief from that.
A few years ago, I didn't either. And a lot of research and experimentation has documented to be very effective. But in the big picture, it makes sense because the whole idea of stem cells are original cells that we have in our body whose design is to go to any area of the body that needs repair and fix it. So we think of fibromyalgia as a more broad-based systemic illness. But if you do an infusion of stem cells, everything that needs fixed gets fixed. And that's why so many people do so much better with it.
Give us an idea of the process, removing, I'm assuming, or you're talking about like a liposuction technique?
The technique is a variant of liposuction, but it's not really meant to reduce fat because the amount of fat withdrawn is really very small, about 40 to 50 cc's, just about enough for one syringe. The idea is within your own fat cells, you have a lot of stem cells, and you can isolate them in a special centrifuge and then reinfuse them back into an area of the body that needs repair. I kind of look at it in a simple way as fertilizer. I put fertilizer on flowers and they grow big and strong. So if you imagine the same idea and someone has a bad joint, like an elbow or a hip, or someone has a bad organ, you could infuse it in that area and it will repair everything. And it gets back to normal without an intervention or a surgery.
And for consultation, I guess it's best we can to just contact you at the Geyer Institute, correct?
That's really easy. Everybody's certainly unique and individual, and oftentimes there's a lot of other adjunctive therapies that really might be helpful too. Especially in a joint repair issue, in addition to doing the stem cells, certain nutritional supplements can be helpful, electromagnetic therapies, as adjunct therapies to really speed it along. Synergistic, if you will.
Dr. Geyer, thank you so much for being with us. The Geyer Institute of Molecular Medicine, and you can go to stylewithbarryandjoni.com to find out more information.